There's one vitamin that you can dissolve directly in your water that triggers such a powerful cascade of vascular changes that blood flow can increase dramatically within just 30 minutes of consumption. This isn't about taking pills or waiting weeks for results. This is about a water-soluble vitamin that, when consumed in the right form and the right dose dissolved in water, activates the exact biochemical pathways your body needs for optimal circulation and reliable male function. Most men have no idea this vitamin can be used this way, and once you understand the science, you'll wonder why no one told you about this approach years ago. Hello everyone, I'm Dr. Charlotte Hayes, and today we're exploring something that represents a complete paradigm shift in how men can support their vascular health and male function through strategic vitamin supplementation. We're talking about a specific water-soluble vitamin that, when dissolved in water and consumed at the right times, provides such profound support for nitric oxide production and vasodilation that the improvements in circulation and capability can be measured within the hour. The vitamin I'm talking about is vitamin C, specifically ascorbic acid in its pure powder form. Now, before you dismiss this because vitamin C seems too simple or too common to be powerful, let me explain the extraordinary mechanisms through which vitamin C supports vascular function and why the delivery method of dissolving it in water makes it so much more effective than taking standard vitamin C tablets. Vitamin C plays multiple crucial roles in vascular health that most people don't fully appreciate. First and most importantly, vitamin C is absolutely essential for the synthesis of collagen, which is the primary structural protein in blood vessel walls. Your arteries and veins are composed largely of collagen, and this collagen must be continuously synthesized and maintained to keep vessels strong yet flexible. Without adequate vitamin C, collagen synthesis is impaired, and blood vessels become stiff, fragile, and less capable of the dramatic dilation necessary for optimal male function. But vitamin C does much more than just support structural integrity of vessels. It's also a powerful cofactor for the enzyme that produces nitric oxide. Nitric oxide synthase, the enzyme that converts arginine into nitric oxide, requires vitamin C to function optimally. When vitamin C levels are low, nitric oxide production decreases, and this directly translates to reduced vasodilation and impaired blood flow. By ensuring optimal vitamin C status, you're supporting maximum nitric oxide production, which is the foundation of healthy male function. Vitamin C also has critical antioxidant properties that protect nitric oxide from degradation. Once nitric oxide is produced, it's vulnerable to destruction by free radicals and reactive oxygen species in your bloodstream. These oxidative compounds rapidly break down nitric oxide, reducing its effectiveness and shortening its duration of action. Vitamin C, as a powerful antioxidant, neutralizes these free radicals and protects nitric oxide, allowing it to remain active longer and exert stronger effects on vasodilation. There's also an interesting interaction between vitamin C and the endothelium, the inner lining of blood vessels. Vitamin C supports endothelial function by protecting endothelial cells from oxidative damage and by enhancing their ability to produce and release nitric oxide. Research has shown that vitamin C supplementation significantly improves endothelial function, particularly in individuals who have compromised vascular health. This improvement in endothelial function translates directly to better blood flow and enhanced male capability. Now, here's where the water dissolution method becomes crucial. When you take vitamin C in tablet or capsule form, it must be broken down in your digestive system, absorbed through your intestinal wall, and then distributed throughout your body. This process takes time, often an hour or more, and absorption can be incomplete depending on various factors, including what else is in your digestive system and the specific form of vitamin C in the supplement. When you dissolve pure ascorbic acid powder in water and drink it on an empty stomach, the absorption is dramatically faster and more complete. The vitamin C is already in solution, so it doesn't need to be broken down. It's absorbed rapidly through your stomach and intestinal lining, reaching peak blood concentrations within 30 to 45 minutes. This rapid absorption means you can time your vitamin C consumption strategically for when you want optimal vascular function. The dose matters significantly. For supporting general health, relatively low doses of vitamin C, around 100 to 200 milligrams daily, are sufficient to prevent deficiency. But for acute vascular support and significant enhancement of blood flow, much higher doses are beneficial. Research on vitamin C and vascular function has used doses ranging from 500 to 2,000 milligrams, with higher doses generally producing more pronounced effects. Here's the protocol for using vitamin C in water for vascular support. Dissolve 1,000 to 2,000 milligrams of pure ascorbic acid powder in 8 to 16 ounces of water. The amount of water affects how quickly you drink it and can influence absorption rate. If using 8 ounces, you'll drink it more quickly, leading to faster absorption. If using 16 ounces, you'll drink it more slowly, but the total amount absorbed will be similar. Drink this vitamin C water on an empty stomach, ideally 30 to 60 minutes before you anticipate needing optimal vascular function. The empty stomach is crucial because food in your digestive system can slow absorption and reduce the peak blood concentration achieved. The timing allows the vitamin C to be fully absorbed and reach peak blood levels precisely when you want maximum circulatory support. You can also use a divided dose approach where you consume 500 to 1,000 milligrams of vitamin C in water 2 to 3 times throughout the day. This maintains elevated vitamin C blood levels consistently rather than creating a single peak. Both approaches are effective, and you can choose based on your specific needs and schedule. The taste of ascorbic acid in water is quite tart, similar to lemonade without sugar. Some men find this refreshing, while others prefer to add a small amount of natural sweetener like stevia or a splash of fruit juice to improve palatability. The addition of these flavor enhancers doesn't significantly affect absorption or effectiveness. Now let's discuss the forms of vitamin C and why pure ascorbic acid powder is the optimal choice for this protocol. Vitamin C supplements come in various forms, including ascorbic acid, sodium ascorbate, calcium ascorbate, and various mineral ascorbates. While all of these forms provide vitamin C, ascorbic acid is the most rapidly absorbed and provides vitamin C without the additional sodium, calcium, or other minerals that can affect absorption and tolerability. Sodium ascorbate is a buffered form that's less acidic and gentler on the stomach, but it adds sodium, which can be problematic for men concerned about blood pressure. Calcium ascorbate similarly adds calcium, which, as we've discussed in other contexts, needs to be balanced carefully with other minerals. Pure ascorbic acid avoids these complications and provides vitamin C in its most bioavailable form. The quality of your ascorbic acid powder matters. Choose pharmaceutical grade or food grade ascorbic acid from reputable suppliers. The powder should be pure white, fine textured, and have a clean, tart taste without any off flavors or odors. Store it in an airtight container in a cool, dry location as vitamin C can degrade when exposed to heat, light, and moisture. Let's talk about the synergistic compounds you can add to your vitamin C water to enhance its vascular effects. L-arginine powder is a logical addition because it's the direct precursor to nitric oxide production. Combining vitamin C with arginine provides both the substrate for nitric oxide synthesis and the cofactor that supports the enzyme doing the synthesis. A typical synergistic dose would be 1,000 to 2,000 milligrams of ascorbic acid combined with 2 to 3 grams of L-arginine powder, all dissolved in 8 to 16 ounces of water. Another powerful addition is L-citrulline, which is converted to arginine in your kidneys and provides a more sustained elevation of arginine levels than taking arginine directly. Combining 1,000 milligrams of ascorbic acid with 3 to 5 grams of L-citrulline creates a powerful vascular support formula. The vitamin C supports optimal nitric oxide production, while the citrulline provides sustained arginine availability. You can also add B vitamins, particularly B6, B9, and B12, which support various aspects of vascular function and work synergistically with vitamin C. These B vitamins support the methylation cycle, which is important for maintaining healthy homocysteine levels. Elevated homocysteine damages blood vessels and impairs endothelial function, and adequate B vitamin status helps keep homocysteine in the healthy range. A comprehensive vascular support formula might include 1,000 to 2,000 milligrams of ascorbic acid, 3 grams of L-citrulline, 5 grams of L-arginine, and 1 gram of L-carnitine, 100 milligrams of magnesium citrate powder, and a B-complex vitamin dissolved together in 16 ounces of water. This provides comprehensive support for every aspect of vascular function: collagen synthesis, nitric oxide production, smooth muscle relaxation, and protection from oxidative stress and homocysteine damage. Now let's address the optimal timing for different goals. For acute support before anticipated intimate activity, consume your vitamin C water 60 to 90 minutes beforehand. This timing ensures peak blood levels coincide with when you want maximum vascular responsiveness. For general daily vascular support, consuming vitamin C water first thing in the morning provides sustained benefits throughout the day. Some men prefer to split their dose, taking half in the morning and half in the afternoon or early evening. This maintains more consistent vitamin C blood levels throughout the day and provides continuous support for vascular function rather than creating peaks and valleys. Both approaches are effective, and experimentation will reveal what works best for your individual needs and schedule. Let's discuss the research supporting vitamin C for vascular function and male health. Multiple studies have demonstrated that vitamin C supplementation improves endothelial function, which is the ability of blood vessels to dilate in response to signals. One study found that men with impaired endothelial function who supplemented with vitamin C showed significant improvements in flow-mediated dilation, a measure of how well blood vessels can expand. Other research has shown that vitamin C supplementation reduces oxidative stress markers in the bloodstream, indicating that it's successfully neutralizing the free radicals that would otherwise damage blood vessels and degrade nitric oxide. This antioxidant protection is particularly important for men over 50, as oxidative stress increases with age and becomes a primary driver of vascular dysfunction. Studies specifically examining vitamin C and male function have found that supplementation can improve various parameters of intimate wellness, particularly in men who have evidence of oxidative stress or vitamin C deficiency. While the effects are most pronounced in men starting with compromised status, even men with adequate baseline vitamin C levels often notice improvements when using higher doses strategically. The timeline for noticing effects varies depending on whether you're using vitamin C for acute support or for cumulative benefits. For acute use, where you're consuming vitamin C water 60 to 90 minutes before desired activity, effects are noticeable within the same time frame as the activity. Better blood flow, enhanced responsiveness, and improved capability are often apparent during that very encounter. For cumulative benefits with daily vitamin C water consumption, most men notice improvements within 1 to 2 weeks. Better overall energy, improved circulation evidenced by warmer extremities, and enhanced baseline function are commonly reported in this time frame. By 4 to 6 weeks of consistent daily use, the benefits typically become quite pronounced as vascular health improves progressively. Now let's address safety and potential side effects. Vitamin C is extraordinarily safe, with very high doses required to cause any adverse effects. The most common issue with high-dose vitamin C is loose stools or diarrhea, as unabsorbed vitamin C draws water into the intestines. This effect is dose-dependent and individual. Some men can tolerate 5 grams or more daily without digestive issues, while others experience loosening of stools at doses above 2 grams. The solution is finding your individual tolerance level. Start with 1,000 milligrams dissolved in water and assess how you feel and how your digestion responds. If you experience no issues, you can gradually increase to 2,000 milligrams or even 3,000 milligrams divided throughout the day. If you notice loose stools, reduce your dose to the highest amount you can take without digestive discomfort. There's been historical concern about high-dose vitamin C causing kidney stones, but research has largely debunked this concern for most people. Vitamin C is metabolized to oxalate, and excessive oxalate can contribute to kidney stone formation in susceptible individuals. However, studies have found that reasonable supplementation with vitamin C, even at higher doses, does not significantly increase kidney stone risk in people without predisposition to stones. Men with a history of kidney stones, particularly calcium oxalate stones, should use caution with high-dose vitamin C and may want to consult with their healthcare provider before implementing this protocol. For men without kidney stone history, vitamin C supplementation at the doses we're discussing is very safe. Another consideration is that vitamin C can affect the absorption of certain medications, particularly some chemotherapy drugs and statins. If you're taking any medications, check with your pharmacist or healthcare provider about potential interactions with high-dose vitamin C. In most cases, there are no significant interactions, but it's worth verifying for your specific medications. Let's discuss the quality of life improvements that men commonly report when using the vitamin C water protocol. Beyond the direct benefits for vascular function and male capability, many men notice improved energy levels throughout the day. This makes sense because vitamin C supports mitochondrial function and energy production at the cellular level. Better cellular energy translates to better overall vitality and stamina. Improved immune function is another commonly reported benefit. Vitamin C plays crucial roles in immune system function, supporting the activity of various immune cells. Men who supplement with vitamin C often notice they get sick less frequently and recover more quickly when they do catch something. This immune support is particularly valuable for men over 50, as immune function naturally declines with age. Better mood and mental clarity are also frequently mentioned. Vitamin C is involved in the synthesis of neurotransmitters, including serotonin and norepinephrine, which affect mood and cognitive function. Adequate vitamin C status supports optimal brain function and emotional well-being. Many men report feeling more mentally sharp and emotionally balanced when maintaining high vitamin C intake. The cost-effectiveness of this protocol is worth highlighting. Pure ascorbic acid powder is remarkably inexpensive compared to many supplements. A 1 kilogram container of pharmaceutical-grade ascorbic acid, which provides 1,000 grams or 1,001 gram doses, typically costs $20 to $40. This means the per-dose cost is just a few cents, making this one of the most affordable interventions for supporting vascular health and male function.